Welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. Today, we are taking a look behind the scenes of the Iowa National Guard and the work they do in Iowa communities to support law enforcement in the fight against substance abuse. We have several special guests from the Guard and the Iowa Counter-Drug Program joining us today, and they'll share a look at how the Guard works quietly behind the scenes to help keep our community safe. Joining us to start things off is Colonel Connors, Iowa's Counter-Drug Coordinator. Colonel Connors, welcome to the show.
Thanks, Peter.
Well, for many people, it's almost a secret what you guys do. Having heard about it, I thought it was important to bring you to the show. Tell me a little bit about the Guard and why they are in our communities.
Absolutely. The Guard is here to help our communities. That's our most important role. Whether it's helping our communities while we fight a war overseas, or whether it's helping our communities during a flood or a tornado. But there's a portion of the Guard, which we're here to talk about today, which is the National Guard Counter-Drug Program, that helps our communities every day, day in and day out, with the fight against drugs.
What kind of people are you working with in the communities?
We support law enforcement officers, we support community-based organizations like coalitions. We are also integral with nonprofit organizations such as the Partnership for Drug-Free Iowa, and work integral with organizations such as the Office of Drug Control Policy here in Iowa.
Now, is this kind of a community-based mission different than the Guard might have been 15, 20 years ago?
Absolutely. And the reason I say that is because the threat of drug abuse has changed. When the Guard was first developed, or the counter-drug program that is, first developed in 1989, our threat was really cocaine. And there was a thought back then, if we take the right resources and apply those resources in the right way, maybe we can win quickly the war on drugs. Obviously, we're still here almost 30 years later, but we're here because the threat has evolved. We've seen it transition from cocaine to the meth epidemic. Then marijuana's always been in the background, but now it's becoming a little more prevalent due to the legalization in some states. And then obviously now the big problem that we're having is the epidemic with the opioids and heroin. You know,
it's fascinating to look at a problem where maybe a lot of the technology for dealing with the drug problem is not too dissimilar than it always has been, but yet the people selling drugs and bringing drugs to market have a lot more going for them. Is it a changing type of person in the Guard today to deal with those challenges?
Absolutely. We've had to adapt. We've taken what we do overseas and learned from those experiences overseas or our support here to apply that to help our partners, whether that be law enforcement or coalitions, to help them better fight their fight on drugs.
Now, you're obviously very passionate. What are some of the things that give you a sense of fulfillment in the work you do?
Truly, it's making a difference. Whether it be in a community and helping that community be able to look at the drug problem, assess the issues that they have, and then seeing them be successful. Or whether it's our support to law enforcement and being able to help them take not just a drug dealer down, but a network of drug dealers and stop a problem in a community.
Now, we've had a lot of guests on this show that work in public safety and different aspects of law enforcement, and everyone says there's been a tremendous stress in manpower and budgeting. Does the Guard also have those stresses?
Yes, absolutely, we have. And how we've learned to deal with that is to become more efficient, to look at ways that we can take the resources that have been given to us and support the most number of personnel.
Now, for the average person that sees the Guard serving in prominent roles overseas, how would you recommend a person understand the Guard today in Iowa? You know, what's its real role? And I might think that the majority of the role is to be at a state of readiness to go fight battles overseas, but in fact, most of the personnel are probably used more domestically.
Correct. Absolutely. We're still, our number one role is to fight that overseas battle should we be called upon. But we also have to be able to support our governor. So every day, day in and day out, we are here to training to support our governor, whether that be in the counter-drug program here or through our units that are ready to go in the event of a flood or a tornado.
Thank you for sharing that, because we have a lot of information to share with people today. It'll give them some insight as to all the things the Guard is involved in stateside. There's an important connection at work between the Guard and Iowa communities. We'll continue the discussion after the break, when we'll be joined by Ted Kamachis, Board Chair of the Midwest Counter Drug Training Center. See you after the break. You don't want to miss this.
Many teenagers don't understand the dangers and effects of marijuana use. Now it's time for Just the Facts, ma'am. An IQ is a score determined from standardized tests to determine intelligence. An IQ of 100 puts the average person in the 50th percentile of intelligence. Regular marijuana use during teenage years can cause a long-term 8-point drop in IQ. A loss of 8 IQ points drops them to the 29th percentile. For more information, go to drugfreeiowa.org.
After Kylie used coke, she stopped caring about school, friends, or who she had to steal from to get more of it. The story of addiction is all too familiar, but you can change it.
Sleeping in, Dad?
If you or someone you know is in recovery from addiction, share your story with the partnership at drugfree.org, because your story can change someone else's.
Hi, I'm Carnell. If you're like me, you spend a lot of time online, streaming shows, downloading files, and Skyping with family. That's why Mediacom recently boosted many of our internet speeds at no extra cost. We call it Always Faster Internet because we're always improving to meet your needs. And when you combine improved speeds with hassle-free Wi-Fi, you get super fast speeds all over the house. So more gets done even faster. The power to make a good thing even better, the power to simplify.
Welcome back to Surviving Bad. We're joined by Colonel Connors and MCTC Board Chair Ted Kamachis from Iowa's Counter Drug Program. They're going to talk about the kind of things they do in Iowa and the partnerships they build. Welcome, gentlemen. Welcome, Ted.
Thank you, Peter.
How are you?
Thank you, Peter.
Well, we were talking about what the Counter Drug Program does in Iowa. Continue the conversation.
Absolutely. One of the things that we really try to focus on in all of the different aspects of the counter drug program is safety. And you'll see a slide here that just gives one aspect of that safety through the training that we do. And with me here is Ted, who has been a part of our MCTC Board of Directors, but also as a sheriff in Marshall County, was able to use some of the unique assets to help him in this fight against drugs.
So as a longstanding partner with the Counter Drug Task Force and also a member in leadership, you have a familiarity with what they do.
You know, when I was first approached about this during the organizational phase and brought on as a vice chair, I was really hesitant, not really sure what to expect. Once it was explained to me what the asset and resources that the Guard could bring to the table, I immediately began to realize that from a small agency standpoint, technology, training, personnel, it was going to be a huge hit, and it has been. Not just in the counter drug, I mean, that's the main emphasis on it, but in a small agency like Marshall County, when we would have a major crime occur, something like that, we were able to call upon them to help us put together other aspects of studying the problem, the environment. So it goes beyond just the counter drug. That's the emphasis, that's where it's really at, but it's been phenomenal what they've been able to do to us. Keep in mind that since Desert Storm, our Guard has been really deployed abroad, and with that has come additional training, technology, the ability to put together cases and do counter surveillance and teach us about just a plethora of things that they learned at wartime. Not just the fighting stuff, but the ability to interact with the community.
So when it comes to fighting a war on crime or drugs, whatever it is, we're able to bring to bear the same kind of technology we develop for the conflicts overseas.
Well, it's organizational skills.
Okay.
That's something that they bring that most of us in small agencies. If you're in New York City with 40,000 cops, it's easy to do this. But keep in mind that 80% of the agencies in this country are smaller than Marshall County is. So what they brought to us was just a wealth of took us to another level, frankly.
What's been the impact in Iowa of that kind of relationship with the Guard?
Just a great impact. We've been well received and become integral members of the law enforcement community and the communities, prevention communities that we've supported. And we've been able to provide a wide variety of support with the specialized training that our soldiers and airmen, we're a joint program, provide to the counter-drug or to the law enforcement. We can provide technical support. That technical support comes about through our analysts that support agencies like TEDS. We can also provide engineer support. We've done drug house demolitions in the past to help that community rid themselves of houses that maybe have drug use or abuse in them or sales, but they're abandoned. We also provide communication support to help law enforcement when maybe those assets aren't available to them. We're allowed to and provided some cannabis support, help with maybe outdoor marijuana grows and either finding them and then letting them tear them down or actually assisting them too. One of our big missions that we do is counter-drug training, and Ted has a big part of that, and I know we'll have a further segment on that later, but really focused on the officer safety aspect is one of the biggest things we try to do.
Ted, is that training aspect a powerful one too for Marshall County like the other thing?
It's massive when you think about it. You're going to hear in a minute about how broad we've reached out across the country. You know, there are 5 schoolhouses out there.
Okay.
The Midwest Counter-Drug Training Center, we have the middle of the country, but we have tentacles across all the states and territories. And what happens is that interaction brings professionalism back here to Iowa.
Now that's in Johnston, I presume, on the National Guard base?
Yes, sir.
Because I know I've been there, and you see license plates from all over, people coming from all over the country. What kind of trainings are provided for, say, officers in Marshall County?
Well, I was thinking about this when we talked about filming this, and I've sent over 30 of my staff at one time or another to various classes put on by them. Everything from counter surveillance, medical trauma, major trauma things. You know, keep in mind the military are experts in that area today. The ability to analyze crime and organize it has been a huge plus for us. We'll get more into that in just a second, though.
Okay, well that's a good thing. So when you see these partnerships, are there enough resources? Do you get a chance to work with a lot of communities around the state?
We'd like to support many more, but with the resources that we have to have available, we do have to prioritize. And we really try to prioritize on where we can have the biggest effect on the most number of people.
Those are great points. We'll look forward to seeing you after the break. We'll get a new guest. We know there are a lot of challenges Iowa's faced with drugs in our communities, and especially the growing opioid crisis. After the break, Colonel Connors will be joined by Lieutenant Schuler. They're going to talk about the things like civil operations and what that means to an average Iowan. Stay with us, it's pretty interesting.
You may have heard about synthetic drugs in the news and the fact that more Iowa teenagers who use them are ending up in the hospital. Synthetic drugs can be dangerous, but you can help prevent the threat. Learn about synthetic drugs and talk with your kids now. For sale does not mean safe to use.
Get help at drugfreeiowa.org.
Thousands of businesses have switched to Mediacom Business for fast and reliable internet, unlimited nationwide calling, and popular TV channels with sports package upgrades. And now, with our new business mobile data, they stay connected on the go. Mediacom Business is the simple and easy way for businesses to get all their telecommunication services from one provider, all for just $99.95 a month. Get a free mobile hotspot device with all 4 services. Mediacom Business. How can we help you?
So who's going to do what?
I'll pack the dead batteries.
Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice. And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
We couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
Welcome back to Surviving Bad. We're joined by Lieutenant Jacob Schuler. We're taking a look at some of the priorities of the Iowa National Guard and how they make a difference in your community. Lieutenant Schuler, welcome.
Hi.
Thank you for joining us.
Thanks for having me. One of the biggest things with prevention or just drugs in general is you can't just take drugs off the street. It's a good thing to take drugs off the street, but you can't just keep taking. What you need to do is try to help prevent the problem to begin with. So what we try to do is we work with different coalitions and community groups and try to help support them with trying to find out what the problem is in their individual communities and just how we can just help them with whatever their needs are.
How would you go about approaching a community and getting this kind of information? How would you work with them?
So a lot of what the civil operations will do, they'll be doing different surveys or reviewing statistical stuff, and just working with the individual coalitions themselves, and just try to help them digest the information and really try to set their goals for what they want to do and what the problems are.
Now, if I was, a high school kid and I wanted to say, well, what does civil operations really mean from the Guard's point of view? How would you define it?
What it really is just trying to help prevent the problem before there's even a problem. So there's not even the demand for drugs or narcotics.
And do you work off of models where you sort of know what the results will be if you do certain things?
Yeah, they do.
What are some of the strategies you employ?
One of them is Kaizen.
Okay.
Just helps with organizational stuff.
Now, do you actually work with community groups and organizations to help them with some of this stuff?
Yes, so our civil operators, they'll either go out to the different coalitions, or what they'll do is they'll come, or we'll go to them and they'll do individual training with them or big, huge group training and just work them through the different steps of what they need to do to accomplish their goals.
Colonel, how would you go about getting in touch with communities? Because every community has a little different level of engagement in prevention and dealing with these problems. It's not like an easy target.
Right, absolutely. So we have a great network that we work within, the Alliance for Coalition, AC4C, that will help us connect with communities that need some help in developing a coalition or making that coalition maybe just a little more effective than what it is right now.
And the trainings that you do are hands-on. I mean, you're actually working with people, teaching them how to do these things?
Yep, absolutely. It isn't just a classroom where they'll sit in front of a PowerPoint. We will sit them down and walk through that assessment, assess what's going on in their communities, and then help them develop methods to address the issues that they've come from their assessment.
Now, public safety is also charged with some of these interactions. At what level statewide do you really engage with public safety to develop some of these mission guidelines for you?
We work with them in various manners, whether it be through, I mentioned the partnership, through the Office of Drug Control Policy, to see what's going on nationally, Caring Community Tour, through a great partnership through not just the Partnership for Drug-Free Iowa, the Office of Drug Control Policy, but U.S. Attorney's Office, to get that ground level assessment of what's going on in the community and then help them, based off of their input, to develop strategies to address their problems.
Jacob, what are some of the things that you can look back on that you've done with a community that you found exceptionally fulfilling?
Really just the people that are out there doing the work, when they appreciate the training that's going on or the support that we're giving, just to know that it has an impact on the community and that it's really helping people from all over the state and the country.
Now, what do you feel that, how many more of you guys do we need to reach all the communities in Iowa that need help? How are we doing on that?
Well, really everything's kind of, unfortunately, it's budget driven.
Yeah.
But with working with the coalitions, it's kind of a force multiplier on them with that. So if we can help one person in a coalition, they've got an impact of 10 or 100 people that they can reach. So really, by working with those coalitions, it's just a huge force multiplier, and hopefully we can try to reach as much of the state as we can.
So the idea of force multiplier and Kaizen, all these methodologies are to be able to take whatever you do and let the word spread and the skills spread throughout the community.
Yeah, really, it's, you know, if we can impact the coalition, then they can go out and get help from the community, and everything just rolls off of that.
Now you're out in the communities. What's the public like when you get out there? Are they seeing a different face of the Guard? Are they trying to figure out why you're there or what's going on? What kind of challenges do you encounter when you're out there with the coalitions?
There's really no challenges. That they really accept us as one of them, and being able to take the skills that we've learned, whether that be here in the States or overseas, to help them look at their problem just a little bit differently, and really accept us as a part of the team.
You know, I'm personally shocked that the armed forces have all this talent to bring to bear on a community level. It really is sort of a hidden talent, a hidden movement. Do people need to do anything that can help you? How do they reach out to you if a parent or somebody says, hey, I'd like to find out more about what the Guard does? What would they do?
We have a website, and the face of our website is actually the Midwest Counter Drug Training Center, which we'll be talking about here in a little bit. And through that, there's a couple phone numbers, a couple emails that can reach out and ask for help if they have some.
Thank you very much. I appreciate the information. After a short break, we'll invite Ted and Sergeant Fair back to get closer to home, asking them to share ideas and advice they feel can help Iowans better understand substance abuse and maybe make a difference in the safety of your community. This is important. You don't want to miss it. See you after the break.
I'm Quinn. At Mediacom, we believe customer service should be as simple as possible. So simple, in fact, you don't even have to dial a phone. All you need is our mobile care app, and you can request a call from a customer service agent, manage appointments, check for neighborhood outages, look up account info, and even reset equipment. And the best part, the mobile care app is absolutely free. The power to connect, right at your fingertips. The power to simplify.
You wouldn't walk through the halls of your school naked. Yet without thinking, many teens sext explicit photos of themselves to friends using cell phones, never thinking it'll go further. But once you hit send, you're exposed. You're out there in cyberspace for everyone to see. Sexting, it's dumb, it's dangerous, and it's against the law.
Watching your sister go through withdrawal is the last thing you expect to do. You hope she gets past it, but worry she'll relapse. The story of addiction is all too familiar, but you can change it.
That's 2 out of 3.
If you or someone you know is in recovery from addiction, share your story with the partnership at drugfree.org, because your story can change someone else's.
Welcome back to Surviving Bad. We've had some very special guests from the Iowa National Guard join us today, and we've invited Ted and Sergeant Fair to get up close and personal with us and share some information, ideas, and advice they feel are important. Pay close attention, might save a life. Sergeant Fair, welcome.
Thank you, Peter.
Appreciate having you on the show. And you are the subject matter expert on the programs and the trainings you have there. Give us a little bit of background of how much coverage you've had.
So the Midwest Counter Drugs Training Center was started in 2003, funded with some foresight from the counter drug coordinator at the time and senior leadership at the Iowa National Guard, and with support from Senator Grassley. It grew from there with bipartisan support from Senator Harkin, and we were really stood up to provide base level training for narcotics officers. So informant training, interview training, some undercover training, and it's really morphed from there into additional topics. Our primary focus now is really officer safety and community safety. We provide a lot of training to smaller departments, and that's our primary target audience is rural and state agencies. We've trained to date 160,000 law enforcement officers from every state in the union. And we've trained over 30,000 just in the state of Iowa alone. So over the years, we started as a regional training academy, and the need is much greater than just Iowa or our surrounding states. So we've been able to partner with the other 4 counter-drug schools to provide training throughout the U.S.
Now, what percentage of Iowa law enforcement communities actually engage in using your services?
So we've had law enforcement officers from every county in the state of Iowa, every state agency, law enforcement agency, and we target specific training to some of those agencies.
It seems that with the level of training you provide, it would make Iowa law enforcement pretty elite in terms of the skill set they may have to deal with, especially the drug problems.
Well, I would say that we like to think that we're helping Iowa law enforcement stay at the tip of the spear, if you will. So, the drug problems don't necessarily manifest here in the heartland. Very often, the threat comes from the borders, from either coast. And what we're able to do is bring in subject matter experts, current and former law enforcement officers, to teach Iowa officers what they're experiencing, what they've experienced, and what's to come next.
Thank you, Sergeant Fair. Ted?
It's interesting. We talked earlier about the size of the organization, how it began. And as the sergeant touched on here, Senators Harkin and Grassley were instrumental in the development of the schoolhouse. But more importantly, they've been there when necessary, when the Department of Defense was not able to fund us. When they went to a heightened war overseas, money, of course, kind of went down here. The senators reached out to Congress and got us plus-ups. It helped us out. And the reason they did this was because of who we train, what we do. I was the president of the National Sheriff's Association, and I've been involved a lot in Washington, D.C. also. And I can tell you that when I've gone abroad, elsewhere in this country, I've heard about MCTC from them. I've had sheriff's offices who have told me that they've sent people to our schoolhouse, or we went off campus and took somebody and sent somebody there to train. So it's been a huge plus for law enforcement throughout rural America, and it's made us better at what we do.
Well, I thank you guys, all of our guests, and you guys especially. Iowa communities have a lot to be thankful for the work that you do and the level of safety and vigilance you allow to be able to keep our community safe. And thank you for joining us today, and keep your eye on Mediacom for our next episode where we explore Iowa's stories of survival, hope, and inspiration, only on Mediacom MC22, your local programming leader.